just seeing what's here at Elliott Chappell, because this is the heart of the fishing industry, famous throughout the world, the Hessle Road. I'm so pleased they've done it the way they've done it. I'm so pleased they've brought that huge respect that Hessle Road has had.
The first line in the NHS Constitution says the NHS belongs to the people. These buildings belong to the people and they need to be used on behalf of the people.
They've taken the community along with them in the design of it, in how it could be used, how they could use it. And that then makes it belong.
It has a huge impact for staff and patients. Obviously, we're in state-of-the-art facilities, they're spacious, they're bright, they're comfortable. I think patients come in and they welcome the new infrastructure.
By having facilities like this, we can integrate how we deliver care much more effectively. So we can have the doctor, the district nurse, the health visitor, all working in the same place. So it's a better package of care that we can operate.
There's more than just, oh, this was where I was born. There's a real spirit here, and this has stayed true to that spirit.
I think the Elliott Chappell Health Centre, being the 12th and sort of last of this particular phase of Citycare, obviously benefited from the lessons learned on all the other 11, and that's the benefit of a programme. You get better and better as you go along.
Elliott Chappell, the one they said we'd never do because the health reforms were far too advanced. Yeah, we did it.
It was in the middle of the uncertainty around the health reforms. Decisions were very difficult to get made. People were very reticent and uncertain about making those decisions. But the power and the strength of the partnership in Hull and the track record of the other 11 we've created successfully and the impact they were having means that we got Elliott Chappell there, and I think we can all be very proud of that one.
We work together with a great feeling of mutual understanding, very open and honest, and a lot of trust between us.
The trick was not to rest on our laurels. Elliott Chappell will be the best of the lot. It should be. We've had 10 years of learning, and it's a building of which we're very proud.
Collaboration is the name of the game. Rather than competition, we need to collaborate more than compete in the NHS, and this provides the perfect venue for such collaboration. In a building like this, GPs can come together, can swap notes, swap ideas. I just spoke to the two receptionists who were just on the left as I walked in and asked them about it, and they were absolutely delighted.
I've seen cultures change and improve because people feel valued. They'll come in the morning to a place that's been built for them to work in, that's obviously built with a bit of care and a lot of quality and a lot of thought, and that attracts talent. It attracts talent to these places. That talent feels valued, and I think hence serves the end customer, the patients, the community of Hull better.
The beauty of having the lift buildings is that they actually are a community asset.
You know, people don't visit the GP that often, so you'll get people coming in here for the first time from the different practices that have located here, who will be astonished to see the excellent facilities that are here compared to where they went before. And they weren't by any means decrepit, but you know, they were showing their age, and they didn't have the ability to bring different practices together and community services and other services in the same place.
So they're not just health centres, they're community centres plus, but with a real reason. I think that's what makes them successful.
We've got a very, very good clinical commissioning group has sort of taken over in Hull from the 1st of April. They are led by local doctors who know what local people want and local people need, and it's about how they respond to that. So we've passed the baton over to them, but I'm very confident that they'll be able to run with it.
Having these buildings in place for the future will help us deliver our vision, creating a healthier Hull, by working with partners, working with local GPs and patients, delivering better and improved services.